You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
This is Unscripted with Surescripts, a series on the Pharmacy Podcast Network discussing challenges facing patients and care providers, and how technology is creating opportunities for change.
Hey, podcast listeners, this is the host of the Pharmacy Podcast Network. I guess I'm not the host, I'm the founder, but host of This Week in Pharmacy, and I've been asked to come back and assist with a special project to bring us additional information on there's so much happening in the plate tectonics, in the transformation of the pharmacist role, and things that are happening with NCPDP and building out AI and technology supportive platforms that will dig down into rare disease. So when I'm at conferences, it's so important to keep our ears to the tracks of our industry and finding out what is happening, what's cultivating, what's pharmacists involved with what is pharmacists not involved with. Like, put that on me and I will go find out why, and we'll get pharmacists involved, because anytime there's a patient involved, we all know that there's a pharmacist that's supposed to be there. And we look to them for insight, and we look for our partners to bring us data and technology. And today we have one of those partners. We're so excited to interview and bring back the Surescripts team to the Pharmacy Podcast Network. Very proud of them and what they're doing. Justin McMartin, your manager, product innovations at Surescripts. I'm excited you're here, Justin.
Yeah, thanks for having me. I really appreciate the opportunity to talk a little bit more about my corner of what I do here at Surescripts.
That's awesome. That's awesome. So you're going to demystify some things for us and help our listeners understand one of the buzz terms that was taking place at NACDS. We just got back. Surescripts had a big presence there. Total Store Expo was this QHIN terminology, which stands for Qualified Health Information Network. And that, of course, makes sense to me, the terminology. But then again, I only knew it from a surface perspective. And remember, in February of this year, in 2024, U.S. Department of Health and Human Services released a press release, and they said Health and Human Services expands TEFCA by adding 2 additional QHINs, and it goes into kind of a description of what that means. But I want to hear it from your perspective, because just to lay the groundwork, as an industry expert, somebody that's been on all things TEFCA and RISI and QHIN, that's alphabet soup to me, to many of our listeners. There's too much of that sometimes in healthcare. But listen, we look to people like you to keep us on track. That's why
Sure.
I'm excited that you're here. So if that doesn't ring a bell to the listener, I want to just give it over to you, Justin, just to kind of set the stage of what we're going to talk about today.
Yeah. So first of all, it was my first opportunity to attend the Total Store Expo. So I had a great time meeting with folks in the pharmacy community, pharmacy vendors and others that are really need to learn about this topic. So again, appreciate the opportunity to talk more about it. To bring you to where you probably need to be to understand this topic, I'm going to give you a little bit of a history lesson. So I apologize for everyone. There's government involved here, public-private partnerships, all those things we love in healthcare. So I'm going to take us all the way back to December of 2016 when the 21st Century Cures Act passed. So that is the impetus of what is the Trusted Exchange Framework and Common Agreement, or TEFCA, was included in that legislation that passed Congress and was signed by President Obama at the time, and ultimately said, federal government, the office of the national coordinator at the time, you need to implement something that will give us a baseline for interoperability in this country. And we called it the Trusted Exchange Framework and Common Agreement. Now, at that time, we had very little knowledge of what that actually meant, right? It was just a few words in a very, very large bill.
Mhm.
Ultimately, what has happened is, HHS and ONC, or the new Assistant Secretary for the Office of Technology and Policy, have ultimately implemented a program that has created these Qualified Health Information Networks, or QHINs, to kind of serve as the backbone of that trusted exchange framework. So hopefully that gives you a little bit of an understanding of where we've come from. But then the next stage is really, where do we go with it? Because to hit that vision that was part of that legislation, back over or almost 8 years ago now, it means that everyone in healthcare, not just providers, not just payers, not just long-term care or special nursing facilities or otherwise, everyone, that includes a pharmacist, should be able to get access to this and be able to both send and receive clinical information in a safe and effective way across the country. And so that's really why we're bringing this to the pharmacy side of it, because so many folks in the pharmacy community haven't been following the development of this program. And ultimately, at the end of the day, to the things you referenced in the beginning here, Todd, pharmacy is changing, and not just pharmacy, where care is being provided is changing. And so the folks that we might have originally thought should be part of this Trusted Exchange Framework Common Agreement need to know about it and need to be brought into the fold.
That's a great stage set, because it's going to open up a lot of questions. And you brought up a memory, how I started in pharmacy way back 2004, started working with Surescripts probably about 2006, at least from what I can remember, purposely working with them per se. And interoperability was the buzzword, because our PMS system, our pharmacy management system, it was dedicated to tracking treatment and everything, long-term care, geriatric, senior care. I said, why aren't we talking to the EHR systems fluidly, not just passing something one direction? Like, where's the treatment follow-up? Where's the communications and the SOAP notes interaction and the pharmacist being able to dig in? And what about the nutritionist and the pharmacist, or the specialist and the physician and the pharmacist? But regardless, that interoperability was a buzzword, and it's never left our vocabularies because it's still on the forefront. So this is kind of like an evolutionary thing. How does Surescripts fit into that? And how are we becoming a QHIN impact? How are we using that to impact interoperability?
Yeah, I'm going to take something you just said there. Interoperability is a buzzword. So at that time, I was starting out my career in health information technology as well, implementing electronic health records in physician practices. Oh, wow. So that's my background, and what I was doing when you started working with Surescripts. But so what Surescripts is ultimately doing is saying, we believe in this kind of purpose, this intent behind the Trusted Exchange Framework and Common Agreement. And, what we've been able to do working with pharmacy, working with providers, there's a lot of folks out there, especially some of those in the pharmacy community, who don't understand that we actually facilitate billions of other transactions that have nothing to do with a patient's medication or medications even, because we're exchanging clinical documents across provider systems and hospitals and other organizations. And we said, look, we have the foundation of what the intent is for a Qualified Health Information Network. And so it makes sense for us to do that. Now, a few quick things I want to say about the way we're approaching it. So first and foremost, we made that decision to say, yes, this is something that's important for us because of how we fit into the broader interoperability community in healthcare. We can bridge the gap and bring a large number of these folks together as part of this framework. But to do that, we also said we want to make sure that we're providing the right level of comfort and all of that to our customers. So our pharmacy partners, folks in the payer community, other providers, And so we created a new subsidiary organization called the Surescripts Health Information Network to be designated as our qualified health information network. And so that's really where my work today comes in, is working to get that set up, get it into what is called a designated QHIN status so that we can start connecting folks and bringing them into this broader community.
All right. So the listener, the pick that's listening right now, the VP of technology, pharmacists out there listening, pharmacy owners. So what can they expect as pharmacies through the QHIN participation?
Yeah. So I like to put it in as simple of terms as possible. And so I'm just going to rattle off a couple of use cases. I'm not the expert on the use cases. I'm the expert on the technology side of it. So just to be clear on that, we can bring a lot of other folks in to talk about all of the use cases and dig into how pharmacists need clinical data. But a perfect example of something we've been doing for quite a few years with some of our partners is, when we think about clinical care in the pharmacy, one of the first areas where it was extended to is providing immunizations to folks. Obviously, very important when it came to the pandemic. But even before that, just really allowing that type of stuff to be much more convenient for folks was able to increase drastically, the number of immunizations that were being provided to folks for things like flu and childhood vaccines and the like. So that's a really important piece of care that's provided in a pharmacy. Well, many states have required folks to, if you do that, to be able to send that information to a provider. Yeah. So much of that information, to their primary care provider, so much of that information today is being exchanged with faxes or even letters. And the Trusted Exchange Framework Common Agreement allows us an opportunity to expand some of the work we've been doing with things like direct messaging and otherwise to be able to deliver those things electronically and seamlessly into a provider system. So that's a really simple example of it, but it goes beyond that as well, because it's not just that, hey, I did something in the pharmacy and I think it's important, provider, about it. It's also some of those newer opportunities or things that we've started to see expanding. Things, I'll call back to the pandemic here again, the test to treat type scenarios where we find out or we can test in the pharmacy for COVID, find out the patient has COVID, and then be able to prescribe them Paxlovid in certain cases. Mm-hmm. And in that type of scenario, we also might need additional laboratory results or other information to ensure that we can provide that prescription in the pharmacy. And it allows us at that point in time, or as a pharmacy, allows us to be able to request information on that patient to see if I can close that loop right then and there while the patient's there without having to send them to get additional lab results or other tests or fall outside of the window of when we really want to get them on that prescription. So I think there's really powerful things that can be done. And you can take those two use cases of sending information or that test to treat type scenario where I need to go request information and take them to a number of different scenarios that obviously folks in the pharmacy would love to be able to do more with and should be able to do more with.
All right. So a shout out to the listeners right now, because they're the ones that are really managing sometimes these systems, the programs, even the IT. We have pharmacists everywhere. And those people that are supporting those organizations too. I want to just let you know, we are packing the show notes with a lot of links that are going to take you to different components of where this has all kind of come from. And then also reference to organizations that have taken the time to put a bunch of people together, super smart people, to kind of make sure that this is all working as intended. And I wanted to just reference, for example, the Sequoia Project and how there was an article that came out of Tech Target in May earlier this year that kind of went into how TEFCA is going to kind of impact networks and even save funding, save taxpayer dollars based on the efficiencies that are being created. So I'm going to reference this article in our show notes too. But Surescripts, you guys have done an amazing job packing this with referenceable data and additional information, because you listen to a podcast. Podcasts are great, but really secondary information to where what we're talking about, where it came from. And that's where you come in as someone who's managing this technology for a nationwide scale. So that's kind of exciting. You got to be kind of excited about being part of this too.
I mean, I'm so excited about it. I mean, just like going back to 2006, well, a little after that, when the American Recovery and Reinvestment Act passed, and for me at the time, implementing electronic health record systems, that was a very exciting time for us to see the expansion of that industry and the adoption of technology in the provider's office, and in a lot of ways, those two things link together because the same vision that folks laid out at that point to say, look, we need more technology in providers' offices. And I guess at the same time, there was a lot of e-prescribing investment as well at that point. We need that technology in pharmacies and in providers' offices and in hospitals and otherwise, because the vision is if that data is digitized, we've got so many better opportunities to understand it, identify where the problems exist, and find ways to solve those problems. And we're talking about the same thing here when it comes to the Trusted Exchange Framework and Common Agreement, because in a lot of ways, it's all been digitized across the healthcare system. It's just that those systems are not necessarily talking together in the most effective way, so that we have those opportunities to look for those potential wins that we can make to really make significant improvements in healthcare. All right, sorry, off my soapbox there from the excited perspective. Can I go back to, you mentioned the Recognized Coordinating Entity, or the Sequoia project. I want to call back to that because I didn't mention that as part of kind of the overall introduction. We have in the creation of this project, this government solution to technology and exchanging information in healthcare, we have a very clear directive that it should be a public-private partnership. And where the Recognized Coordinating Entity, that's the title of the organization, comes in, that's who is kind of picked by the government to administer the program. So the Recognized Coordinating Entity, who is currently the Sequoia project, is the one who administers and validates those qualified health information networks and allows them to get connected to this framework. So that's a really important piece of this of this whole process that I didn't mention. So we work very closely with the folks at Sequoia, and in fact, because of that role, one of the things that Surescripts has helped to do is sponsored a pharmacy specific work group within Sequoia to talk about interoperability and talk about the needs within pharmacy. So folks listening, if that's something you're interested, obviously we'll probably have links in it, as Todd mentioned. This is something that, if you're interested and want to get more involved in this broader interoperability and how pharmacies can plug into that, it's a great place to channel that type of energy. So I would encourage you to participate there.
Yeah, Justin, I participated in an NCPDP work group. I think it was number 14. It was a long-term care group at a time, and got to work with people like Shelley Spiro and all of these people that have kind of like been instrumental in taking us from where we were, making me feel old saying 20 years ago. I'm like celebrating my 20th year in pharmacy. That's horrible in some ways. But what I'm excited about this Sequoia group is there are organizations that are literally, their entire mission is to drive pharmacy care forward. We're talking about the NACDS. We just got back from Total Store Expo. They're involved. We have Lisa Schwartz from the NCP and SCPA that's focused on community pharmacy. We're actually headed there coming up in Columbus in October of 2024. So I'm excited to see that you're pulling in subject matter expertise in sectors of pharmacy that may have something just a little bit slightly different about how information is being passed and used throughout the networks that are being created, and giving advice and guidance to the work group. This is wonderful. I do want to shout out to pharmacists out there, the ultra nerdy ones that may be tied into IT, tech, code writing or something. If you're part of an organization that is touching this kind of data and the fluidness and interoperability, please look at that Sequoia project. And we're going to talk a little bit more about that on our next episode. I'm so excited that we're kind of doing a follow-up with this, Justin. But Guy, this has been really good. And I want to, not to put you on the spot, but tell our listeners, this is your first podcast?
It is long-time listener, first-time caller, I guess, type of a scenario.
Awesome. Well, you did amazing, and you're a great resource. So we're glad to have you be part of this. I always say #TogetherRx, and really bringing together multiple people that are supporting pharmacy care and technology, communications, public relations. That's all the stuff that I'm comfortable with. Please don't make me do anything clinical, or somebody might get hurt or pass away, because I don't know, and I don't belong there. Neither do you. So let's
exactly. Yep. I'll stick to the technology.
Stick to the tech. Hey, listeners, we appreciate you and what you're doing out there for pharmacy care. We know it's not easy when everything's kind of shifting around us. If there's anything that Surescripts can do for your organization from a technology perspective, clarification, please reach out to them at surescripts.com. In the show notes, we will have a link to reach out to them directly. But I just want to thank you for what you do out there and taking care of our 330 million people in this country. It's crazy. And in my opinion, Justin, there's not enough of us in pharmacy care to take care of the rising population. So this is important to have tech to kind of make things a lot more efficient.
Yeah, absolutely. And appreciate the time to keep spreading the message.
Absolutely. Thank you so much for listening. We'll talk to you soon. You'll hear from us in the next episode on this Surescripts podcast.